genetic add-on panels enhance checkups by identifying inherited risks and guiding personalized prevention.
Hello, I am Associate Professor Dr. Tahabasi. I serve as the head of the Genetics Department at Memorial Health Group. Within our health group, we provide services to patients together at our 2 genetic diagnostic centers. Of course, we don't just serve patients, because nowadays, genetic tests have become very important in modern medicine, even for healthy individuals. If we evaluate these in a few different situations, I would first like to talk about preventive tests related to cancer, or tests that can provide clues. We know that about 10% of cancers are classified as hereditary cancers. So what does this mean? We know that there is a familial predisposition underlying 10% of cancers. In other words, when mutations take place in one or more of the specific genes that prevent cancer, we refer to these as hereditary cancers. In which situations do we suspect these? For example, if an individual has developed more than one cancer, has been diagnosed with cancer at a very early age, or if there is a strong family history of cancer in an otherwise healthy person, then we suspect a familial cancer situation. In such cases, we definitely recommend investigating whether there are mutations in the genes that predispose to these cancers. Let me give you an example. The patient is a woman or a healthy individual aged 35. She says, for example, my mother had breast cancer, my sister had ovarian cancer, my uncle had colon cancer. She tells us stories like this. In this case, we definitely suspect a familial predisposition to cancer, and we want to find out whether she carries such a mutation herself or not. To investigate this, we try to clarify the situation with tests we perform using a very simple blood sample. When we detect something like this, of course, we have some recommendations for the patient. Depending on which cancers the relevant gene predisposes to, we implement protective measures accordingly, consult the appropriate specialties, and try to prevent the patient from developing cancer. Or we carry out planning and clinical management, such as those associated with the very early detection of disease. Of course, on the other hand, there are also other tests that are applied to healthy individuals. For example, in what we call polygenic risk scoring, unlike hereditary cancer predisposition genes, where there is a clear pinpoint mutation in a specific gene specifically, rather than saying this gene causes a predisposition to this cancer or that disease, it involves adding certain scoring systems along with the patient's other factors and genetic information to determine how much higher the risk is for certain diseases compared to the general population. These are the kinds of tests that shed light on such questions actually. For example, to what extent has their predisposition to cardiovascular disease increased compared to the general population? To what extent has their risk of developing prostate cancer increased? How susceptible are they to Alzheimer's or to hyperlipidemia, that is high cholesterol? Tests that measure a greater number of parameters like these, or for example, what we call pharmacogenomics. Which group of drugs, what rate of metabolism do they have? So for instance, if someone is going to use a drug related to cardiovascular disease or a drug related to neurological diseases, what is the rate at which this drug is metabolized in the body? That is, how quickly it is broken down and used. There are certain genetic tests that indicate this so that the safe dosage range can be adjusted by the relevant physician. In this way, we have a genetic approach to healthy individuals. Of course, I would like to add one more very important piece of information. These, of course, are related to knowing certain predispositions in advance. Additionally, genetic tests for early cancer detection, which can reveal lesions we call precancerous and alert us to cancer at a very early stage, are rapidly becoming a part of our lives. Here in Turkey, we are about to start implementing this for the first time in a very short period. With just one tube of blood, it provides very early information about approximately 10 types of cancer. We are about to start performing a series of important and comprehensive tests in our laboratory that are capable of detecting cancer even at the precancerous stage, before any clinical or radiological signs or symptoms appear. Indeed, even before the cancer actually develops. I sincerely wish everyone healthy and happy day.